Hello and welcome to this episode of Inspiring Women Leaders. It's my honor and privilege to be interviewing my friend and medical colleague, Dr. Lara Hochman today. Dr. Hochman is a family medicine physician and advocate for fellow physicians' well-being amidst rising burnout and dissatisfaction. Her own experiences led her to discover the ways physicians lost autonomy and how to reclaim their focus on helping patients. She's the founder of Happy Day Health, a boutique physician matchmaking agency to match doctors with well-run, physician-owned private practices where they can avoid burnout and enjoy practicing medicine again. What an incredible mission, and I think it's fair to say Dr. Hochman is leading the way with inspiration. So without further ado, let's meet Dr. Hochman. Welcome to the show, Lara. Thank you so much for agreeing to come on and speak to the show's audience.
Thank you for having me today.
Oh, my absolute pleasure. So let's just start with, in your own words, telling the audience a bit more about yourself, including what your current work roles are and what leadership positions you currently hold or have held in the past, please.
Sure. I'm a family medicine physician, and I'm still practicing as a locum tenens. I started my company, and that's what I do most of my time, is helping match physicians with physician-owned private practices. The positions I've held in the past, so I was in a practice which was very similar to the direct primary care model, but within a larger company. And I was the lead physician for my practice or that site. And as time went on, I moved up to be the lead physician for Texas, for the state of Texas.
Wow.
And that was such a wild ride. I absolutely loved it. I loved the people I got to work with as a leader. I learned so much about myself and about leadership and about all the cool people that I got to work with. And and right now I'm working on this company. I feel like I can have a great impact on each physician that I place because I'm taking them from a place of burnout to a practice that will really value their autonomy, value them as a physician and as a human being. And so, with that impact that I can have on each physician, I also believe I can really have an impact on the way medicine is practiced as a whole in this country.
Sounds like you absolutely could. That's a fantastic vision and a really noble cause. So thank you for doing what you're doing. Can we just move on to ask you a little bit about your personal leadership style?
So my leadership style, and I think this is something that's always evolving. My favorite thing as a leader is to really develop my people. So as a leader, there were certain people that I was so lucky to work with that really leaned into that. And we did some coaching, and I got to really develop them as leaders in their own right, or help them to achieve what they were interested in. What I like to do as a physician is really be there, be present, be available for the people that I get to work with, the people that I supervise, and support them on what's important to them.
Yeah, fantastic. So it sounds like you really, kind of cared about your team's professional development, and you kind of put their needs first, and a sort of very caring, compassionate servant leadership style. Thank you for that. So can you tell us about your journey to leadership? So from when you were a qualified family physician to the lead physician roles that you got, please.
Sure. So I started out, I left residency as wanting to be with my kids. I just wanted to go to work, see patients, come home. And I really enjoyed that, actually. The practice that I joined, I got a call one evening from my boss, and he said, "Hey, do you want to be the lead physician for the practice?" I said, "I don't know. What does that mean?" And he said to me, more responsibility, no more pay. And I was like, okay, but
standard.
So I said, okay, but what does that mean? He's like, I don't know, you'll figure it out. So I figured it out. And it really was fun because I got to figure it out with some great people. I was working alongside a nurse who had leadership experience, and she was very instrumental in helping me figure that out. There was one evening where we were sitting together at dinner, and I said to her, gosh, I really wish we had a policy in our practice where, it's a refill policy that I explained to her. And she said to me, you're the lead physician. You can make that policy. And that one conversation was so pivotal because I realized, wait a minute, I can make the decision. And I did, and it was wonderful. And so, along with her, I really was able to develop a comfort in leadership and in setting the policies of the practice. And the practice thrived. I mean, we had the highest patient satisfaction scores in the entire company. We had the highest employee engagement scores. We did awesome. So, I would credit my leadership development a lot to this one nurse who helped me see that I can make these decisions. And just kind of went from there. When I was offered the Texas lead physician role, which was a lot more hours than I wanted to do, it wasn't necessarily that I ever had this dying interest to climb the corporate ladder. It was just, gosh, that sounds really cool. And this is a way that I can impact people. And yeah, that sounds like really great. I love people. My relationships are the most important thing in the whole world to me. And this was a way that I could help to develop people who I really liked and have an impact. And I know what needed to be done. So I tried to do that. So
yeah. So you grabbed it with both hands, that opportunity. And I'm just interested, how long had you been working as the lead physician before your nurse colleague said to you, well, actually, yeah, you're the boss. You can you can make decisions.
That was probably maybe a couple of months, maybe
right.
1 or 2
Okay.
months. Yeah.
Okay. Yeah. And then that was it. You just owned it, and you felt empowered, and
yeah,
quite liberating.
I think you're never stop learning. And I was very fortunate that the clinic was such a smooth running practice before I started being the lead physician. It was a brand new practice when I joined. So we were just a very close team, and it was seamless. It was really easy.
Yeah. It's really lovely to hear that, you were inspired by your nurse colleague as well. You don't hear that from doctors very often. So that's a really nice thing to hear. And so over the years, apart from this fantastic nurse colleague you've mentioned, were there any medical colleagues who were senior to you, female or male, that helped you along the way with your leadership journey?
Yeah, all along the way, there have been people that have helped me in medical school, residency, attending life. They've actually mostly been male. I felt like these are the people who saw in me things that I didn't see, or they believed in me when I didn't believe in me. And, in residency, in medical school, it was a little bit of both. I did some research with an attending, and this one was a female. She was absolutely wonderful, and she had me write a paper, and there was no competition. This was my attending, and she put me as first author. So it was wonderful. She had me present at an international conference, and then there were some male attendings. So I almost went into ear, nose, and throat. So these were all ear, nose, and throat physicians, and they believed in me, which was wonderful. And then in residency, all of my attendings were wonderful. There was one in particular who he interviewed me, actually. And even in the interview, he made it very clear how much he believed in me. I went to do a second look, and he was there to cheer me on during residency. He knew what I was interested in. He knew that I liked procedures, and he always sought me out for procedures. And just knowing that someone believed in me, which was so huge. There was another physician who a few years later I flew back into Colorado for his retirement party. And I was telling him, I'm really burned out. I'm thinking about leaving medicine. And, a few days later, he emailed me and said, you can't leave medicine. And this is why. And he just laid out all the great things about me. Then I was like, oh my gosh, you're so sweet. And it was really heartwarming. And I'm really glad he did that. And then as an attending, it was my supervisors and my bosses who were the older males, who, once again, I'm so grateful to them for helping me achieve those leadership positions where I was able to develop as a person and as a leader and as a worker bee.
Yeah. Thanks so much for sharing that. That sounds truly wonderful. It sounds like you've been on the receiving end of and seen and witnessed some really fantastic leadership over the years, which is so heartwarming to hear that. And things like, that attending who put you as first author, and she encouraged you to present at an international conference and so on. It's just the way it should be, isn't it, really? She didn't need another paper where she was first author. Yeah, she's already made it, right?
Exactly.
It's time to help lift up others, isn't it, really? And I can see that those positive influences have impacted and rubbed off on you, and the way that you have led your colleagues over the years. So yeah, very, very, very nice to hear all this. So well, I don't want to put a downer on that fantastic bit of the conversation, but did you experience any challenges on your journey, and if so, how did you cope with them and move past them?
Yeah, there've been quite a few challenges. I think in my leadership positions, probably the biggest challenge was when I was working my butt off after hours and long hours for people who don't necessarily see what I'm doing. And there are things that are out of my control that I wasn't able to affect no matter how much I tried. And being on the receiving end of those complaints about things that I couldn't do anything about was really, really tough, because, I was still a part of a system that ultimately had the final say. And then in starting Happy Day Health, there are so many challenges. Oh my goodness. I mean, a lot of people think of me similarly to a recruiter. And a big part of why I went into this is because of how much I hated recruiters. And I carry that feeling with me. So when I speak with physicians or try to speak with physicians who don't necessarily understand who I am or what I'm about or the impact that I'm trying to make, I think a lot of, I understand what they're feeling. I've, since starting this company, actually learned that recruiters get into recruiting because they want to help people. So it's changed the way I see recruiters, which has been absolutely wonderful. Yeah. But I 100% understand what physicians are thinking when they say all these things that I've felt myself too. So I get that. But yeah, there's a lot of challenges. I mean, all the challenges that the private practices are having in hiring, it is a challenge to find physicians. The hospital systems are offering the big shiny salaries and the 6 weeks of PTO or whatever crazy thing that the private practices can't necessarily offer. And then once they join those hospital systems, they then have this ridiculous non-compete. So if they want to get out of the system, they're kind of stuck. And that makes it challenging for the physicians. It makes it challenging for the private practices. And it makes it challenging for people like me who are trying to help those doctors get out of those abusive situations and into private practices where they can practice with autonomy. I don't think physicians realize how important autonomy is until they've lost it.
Yeah. Yeah, no, that's very true. Very, very true. Yes, yeah, challenges as a result of being sort of seen as a recruiter, and you're in that unique position that you can see it from both sides, which no other physician that I know has been in that position. So, well, I mean, you are kind of a standalone really in this industry, aren't you, I suppose? So you're the only one who has that perspective. But how lovely for you to be able to reframe your own sort of prejudices in a way, and come to a different understanding and conclusion of what are really a very much maligned and misunderstood profession, aren't they? Recruiters, by the sounds of it.
Absolutely.
They are essential, and they do want to help. So yeah, thank you for sharing that. In addition to that excellent advice around negotiating your way through those workplace challenges that you mentioned, do you have any other advice for our listeners on how to become a strong and kind leader?
Yeah, I think it all comes to listening and communicating. You really want to listen to your people, and be a good communicator. I think that's probably my biggest challenge, is in being able to communicate what I'm thinking and what I'm doing for people, or, and just communicate that I'm listening and that I hear them. But I would say absolutely, people want to be heard, and people want to be understood. And to be a good leader, you really want to listen to their ideas, and if you can, act on them, and if you can't, at least let them know why you can't.
Yeah, that's excellent. Yeah, definitely. I was talking about this recently with a colleague about the need that we have to feel heard and feel part of a team, and otherwise you just feel like you're invisible, and what's the point in going to work? And work's such a big part of our life, isn't it? So that's great advice. Thank you so much for that. So what would be your take home leadership messages for our listeners then?
Take home messages: it's super fun. If you're thinking about getting into leadership, it's a great experience. You'll learn a lot about it. Don't ever stop learning. Don't ever stop developing yourself as a leader and as a human being, because it just goes a long, long way.
Yeah, very much. Self-leadership and self-development, very much hand in hand with leadership. Thank you so much. That's excellent. So what are you currently excited to be working on that you'd like to share with our listeners then?
Right now, I'm working on a bunch of different private practice positions, mostly in pediatrics, family medicine, and internal medicine. And it has been so much fun. The practice owners have inspired me. They have restored my hope in the future of medicine. I've been working with direct primary care practices who are innovating and changing the way we practice. I'm working with a practice that takes mostly underserved Medicaid patients and is able to use the private practice model to really have an impact. And she innovates in how she's able to do that. I would say all of the practices that I've worked with have been so wonderful in how they negotiate and how they value their physicians and in how they treat their physicians. It's so heartwarming and wonderful to see physicians staying in practice for many, many, many years and not job hopping because they're happy. So I'm excited for the physicians that find their way to these practices. They're going to be very happy.
Yeah. It's so nice to be hearing that, especially at this current time, coming out of the other end of the pandemic. The Great Resignation has occurred or is occurring. So much disillusionment out there and dissatisfaction, and doctors leaving the profession left, right, and center. So how wonderful to hear that you're working with some great practices that really value their physicians, who are all extremely happy working there, and that you are playing a pivotal role in bringing physicians into those kind of that happy throng, so that they can thrive in their working lives too. That's excellent. Thank you. So if any of our listeners would like to reach out to you, what's the best way for them to do so?
You can reach out to me through my website, which is www.happydayhealth.co. That's not .com. You're welcome to reach out to me on LinkedIn. My name there is Lara Hochman, MD. And in the show notes, I believe you're welcome to reach out to me on Instagram, Twitter, TikTok. I'm on them all.
Yeah, for sure. Absolutely. We'll put all those links in the show notes. So, of course. So, well, is there anything else you'd like to say before we close the episode?
No, I thank you for the work you're doing. It's absolutely wonderful. And thank you for having me on the show.
Well, no, thank you so much. It's been a wonderful episode. Thank you for coming on the show and for sharing all your experience and your fantastic advice. I'm really grateful. Thank you so much.